Hi there everyone. Welcome to those that are tuning in for another one of our Facebook Live presentations, and this one today is on the S word, which is otherwise known as sciatica. So just welcoming everyone there, just tuning in. Hopefully you're all logged in okay. And welcome to the Platinum Physiotherapy Facebook Live presentation. And this one today is on a word called sciatica that we call the S word here at Platinum. So I'll just wait till a few more people are logging in, and then we'll have a little bit of a chat about what we're going to be talking about today. If there's any questions that you had that you didn't get a chance to message in advance, just use the messenger function in here, and hopefully we can add those questions and obviously give you some answers as we go along today's Facebook Live presentation. And we've got plenty of time, hoping that we should be able to present everything we want to talk about relatively quickly, sort of 15-20 minutes. There's lots to talk about, but we'll cover quite a bit during that time, and that leaves some time for some questions that hopefully you've got that you can just pop in the box there, and we'll answer them as we go along there. So for those that don't know me, my name's Neil. I'm one of the physiotherapists here at Platinum Physiotherapy. We're in County Durham in the northeast of England. We have been around since 2008. All of us specialise in lower back and neck pain, and so something we're going to talk about today is close to our heart, and that's the S word, which is called sciatica to people that aren't in this building, because we actually don't tend to use the word sciatica, and we'll talk a little bit more about why that is as we go along. So just as a few more people are logging in, we're going to go a bit of an outline, ask you a few questions. Obviously I can't see all of you, but it doesn't mean that you can't take part. We're going to be asking you some questions that you can ask yourself. Then we're talking a little bit about the anatomy, and then we're going to talk about what the S word means or could mean, and then talk about the causes of sciatic pain and how we deal with them in 2020. So the first question to ask yourselves, and you can put up your hands at home if you want to, hands up if a medical professional has ever diagnosed you with sciatica. Now, there'll be a few hands going up. There's not a day that doesn't take part in our world here where someone doesn't come in and part of their story is that time they were told they had sciatica. So have a think about whether your hand is up. Hands up if you've told someone else that you're suffering from sciatica. And normally the two are connected. If someone's told you have sciatica, it makes sense that you would tell someone that you have sciatica. It might go a step further and you might tell someone they've got sciatica. And hopefully the things we'll talk about today will make you understand why that, in my view, is not a great diagnostic way to do things. We don't feel sciatica is a diagnosis or a condition, and you'll understand why over the next few minutes as we start to talk about this. So think about the history going back. When did that S word come into the forefront of your mind? If I call it the S word, it's because I don't use the word sciatica, and again, the reasons you'll understand as I go along today. So think about your own history. Why do we call it the S word? Well, the sciatic nerve is a structure. It's an area, and we've got a few pictures here that I'm going to hold up. What I might do is just hold up this one, and you can just see, if I hold that up there, the sciatic nerve arises from the spinal nerves of L4, which is the lumbar fourth vertebra, through to what we call the S3, which is the sacral nerves. The L4, L5, the lumbar vertebra, obviously moving parts. We have a lot of control about what they do. And the S1, S2, S3, the sacral nerves, we don't have a lot of control over the movement of that area, because in effect that's the bit that fused through evolution. Obviously there used to be tails. Now there aren't tails, obviously, because we're humans. Therefore, the L4, L5, a little bit more control over what happens, less so the S1, S2, S3. But you can see that the sciatic nerve, it continues its journey further down here that you'll see as we go along. But that's kind of where it starts. Little branches, and it turns into the sciatic nerve. It is a structure. So at this point in time, we have to ask the question to the person that invented the word sciatica, where were we going with this one? And the best way to explain it is, okay, the sciatic nerve is a structure, and I'm just going to show you here. You'll see the sciatic nerve is a structure, like I showed you. It then becomes a green, on this picture, long nerve from those 5 areas above that we talked about. It is a structure. But I can name a whole lot of other nerves in the body and stick an A on the end of it, and I don't have ever heard those being called a condition as well. We have a femoral nerve in the front of our thigh. I've never heard of a condition called femora. We have an ulnar nerve that is often there with people that have tennis elbow type conditions. I've never heard of a condition called ulnar. We have a facial nerve that innervates the muscles in our face to allow us to do things. I've never heard of a condition called fascia. All of these nerves are in the same pot as a sciatic nerve. Why did there become a word called sciatica that then over time has morphed itself into a condition called sciatica? And I hope that that makes you understand why we call it the S word, because it doesn't, in our view, make sense. It never has, and I'm a physiotherapist of 20 years. I've been fortunate enough to always be around lower back care, and it's a word I've never used as a diagnosis because it just doesn't make sense. The sciatic nerve is a body part. In an analogy that I use with patients, it would be like having a car at the mechanics with the bonnet shut and the mechanic saying your car's got a problem. I don't know what it is, I'm not going to tell you, but I'm just going to call it something that's in there. And that's why I think when we look at the analogy, we want to get a diagnosis. Sciatica is not a diagnosis based on what hopefully I've said to you there. It is a body part. There's a large number of causes of sciatic pain, and that's why I think we tend to go towards those words, sciatic pain, because it got to the stage, I think, 10, 15 years ago, I would say, where anyone with leg pain had sciatica. For many health professionals, it kind of went that way. I don't know why, I don't know how. Did people lose confidence in diagnostic skills? But if you had pain between the buttock and the knee, or sometimes the calf, you just had sciatica. And that was a problem because sciatic pain can be caused by so many different things, and we're going to talk about a lot of these now. Not in too much detail because we haven't got time for a full anatomy lesson, but the treatment of each will be different. So therefore, if we're putting sciatica or the S word as a term, we've got a problem now because the treatment might not be the right treatment, because some treatments are completely contradictory to each other, as I'll talk to you about. So let's talk about the most common cause of sciatic type pain. And by sciatic type pain, I'm saying someone that has pain going down somewhere in that area, anywhere between the buttock, wherever that sciatic nerve travels. It would be fair to say you may have pain somewhere to do with the sciatic nerve, but the causes can be very different. The most common, believe it or not, and this is at lower back as you're looking at the model here, we have our joints or our vertebra. From side on you can see vertebra, L5, L4, L3, L2. Every vertebra joins to the one above and below it. So if I take the nerve out of the picture, you'll see there's a bony bit there and a bony bit there. They become a joint, and we call this a facet joint or lumbar spine joint, whatever you want to call it. This will be the L4, L5 joint. A vast majority of the patients we see in private practice for lower back pain will have facet joint problems. You have a ligament that joins the joints that you can't see on this particular model, and a lot of these injuries, if it's a normal, what we call back incident of not too significant nature, will be a facet joint or ligament strain. Now, the inflammation around this area, much like an ankle that sprains and swells up, has a similar effect. And then when we talk about that first picture, when I showed you that the sciatic nerve starts at L4, L5 and below, guess what's in the area? Those little same nerve branches that come down from your spinal cord. They come out of L4 or L5, they wind their way down to where that becomes a sciatic nerve. You can have small bits of inflammation from a small ligament strain or sprain, whatever you want to call it. The inflammation can be pressuring on that nerve, which is yet to become the sciatic nerve, but because the pathway goes down that same journey, you can end up with sciatic nerve type pain from a ligament strain, and in fact from the inflammation from the ligament strain rather than the ligament strain itself. So we've got a problem now if we're saying that that's sciatica, but hang on, the injury is a ligament strain. It's actually not a nerve injury, but inflammation is causing some pressure or whatever you want to call it on the nerve. We don't tend to use the words trapped nerve in this practice. The symptoms could then become further down the leg. If the person ices the area, as you would the swollen ankle, the inflammation will come down. Any pressure near that nerve root coming out of the spinal cord there will be reduced, and the problem will often disappear very quickly, and you can concentrate on the real problem, which is the injury itself. So someone self-diagnosing sciatica from a lower back facet joint ligament strain, we got a problem now because they're not addressing the cause, which is up here. And this is the most common injury we see for lower back pain and people that have referred pain is from what we would call a straightforward joint, facet joint or ligament injury. And we'll talk about what we do to help those ones a little bit later. The second one, we'll talk about a muscle. People have heard of piriformis muscle, and I'll just pop this up here. You can see there's a little line pointing to the red piriformis muscle there. The yellow sciatic nerve is on the model. The sciatic nerve and the piriformis live very close. In fact, in some portions of the population, studies have shown the sciatic nerve goes through the piriformis muscle. So it's actually connected just with the way those people are made. Therefore, tightness in the piriformis muscle can also cause sciatic nerve pain. But hang on, piriformis is not a lower back structure. It's a muscle that joins from the lower back over towards the hip region, but it's got nothing to do with discs and the lower back structure itself. If it gets tight, then of course it would make sense that a nerve that lives near it, which happens to be called the sciatic nerve, could be a problem and you could end up with sciatic nerve symptoms. But hang on, the cause is the piriformis muscle now. So if I'm going with the sciatica word, the S word, I've got a problem now because again, where am I veering my treatment towards? Piriformis syndrome, which is a very common cause of sciatic nerve pain, is one of the fastest responding conditions. Why? If it's a piriformis muscle tightness, then let's loosen it off. Let's get the muscle back to where it should be so that it's not tightening. Again, this is not why we don't call trapped nerve. Because if we're saying trapped nerve, where is the nerve getting trapped? Technically, you could say piriformis is a part of a trapped nerve situation. But if I ask 100 people in the street that have had back pain about trapped nerves, they won't be saying piriformis. They will be heading somewhere up into the discs and other things we're about to talk about. So, piriformis syndrome, lower back facet joints, two completely different injuries, similar symptoms, treatments, very, very different. The next one, and this is where a lot of people will get dragged into the S word conversation, may have, or think they have, disc injuries. Disc injuries do not scare us in the context of treatment in 2020. In the 22 years of being a physiotherapist, disc injury treatment has changed completely, 180 degrees for the better. We're no longer scared of telling people this could be a disc injury, knowing that the proof of that objectively would have to be an MRI scan, but the treatment would be very similar whether it needs an MRI scan or not. In other words, if you get the strength around a suspected disc injury right early on, not only will you prevent the need for an MRI scan or further intervention, but if it needed further intervention, the strength work would be the same anyway, whether you need injection, surgery, whatever. So we look at the discs from side on, vertebra, then you see the disc is the different colored thing there, next vertebra, next disc, next vertebra, next disc. So we look at the L4, the second bottom vertebra, the L5, the bottom vertebra, the one with the red bit here is the L45 disc, and on this model, as many models would have, is to illustrate what a bulging disc could look like. So from side on you can see there's obviously a bit out to the side as it were. From side on, if the nerve came back into play, the one that I took out of the picture before, you could see that the nerve just there and the bulging disc, the red one, are just coming together. You can just see the red and the yellow there. Now with bulging discs, and this is why I don't really make it a disc seminar today, a lot of people use the word slip discs. We don't, because it's not correct. The disc doesn't slip anywhere, it doesn't move itself. It's like toothpaste. It's a toothpaste and a tube, and when you press the toothpaste tube, you know the toothpaste moves. Discs are the same, a hard outer shell with a soft inside, and the stability is very important because that's what discs are there to absorb the shock through the spine all the way from our neck all the way down. So this is what we call an exaggerated disc bulge, but for the purposes of the model, it is contained within the toothpaste tube. If the muscles, particularly the core muscles around the front that do the stability work of the lower back, are very strong, then the ability for this toothpaste to be disruptive is reduced. The stronger you are in a contained disc bulge, you would expect the contents of the disc to be in the right place in terms of the support. The actual contents that are doing the bulging are very small. In the context of 100% of the disc, only a small amount of percent of the disc is causing the havoc, and therefore if you're unfortunate enough to have pressure on the nerve from a disc problem that causes sciatic pain, you're still able to do a lot about it. A protruding disc, which is very separate, would be something where the patient's not responding. They're getting stronger, but there's no relief, or they're not getting stronger with the effort they're putting in, and an MRI scan might show a reason. There's a protruding or a prolapse disc where the toothpaste tube is disrupted. The disc contents there have an exit that is just the problem on the MRI scan can be seen, and the disc can be really protruding onto the nerve. But the strength work you do in the lead up to needing an MRI scan, whether it be acute in A&E or over a long period, you still need to build up the stability around the spine because of the nature of the disc structure. And that's the more ones you have to keep an eye out for. The sinister disc presentation, an MRI scan might show why the person's having referred pain down the leg, pins and needles, loss of muscle strength, reflex problems, all of these things that we as health professionals have to test, and we don't hesitate to refer on for one of these ones that just doesn't seem to add up, and they can be having the sciatic problem. So why would we call it sciatica? Because the treatment of the very safe type piriformis is very different to the person that might have a very nasty protruding or prolapsed disc that will almost certainly require a surgical intervention. But the numbers that will require surgery intervention for disc injuries is very, very small in 2020. And the strength work you do post-disc surgery is identical in terms of what we're achieving around the core to those people that will avoid surgery from minor disc bulges because of the strength work they would do. So you can see how that already the sciatica word, the S word, is becoming a bit messy now, because now we've got at one end people that may need surgery almost certainly, and those where it's got nothing to do with the lower back structure in the first place. So I hope by now you're starting to get a feel of why the S word is something we don't agree with, and it's not right for us to pigeonhole every person with pain going into the buttock, down the leg, with the same, because that's not correct at all. Hamstring pathology. Let's put it in there. People have hamstring pain. They have hamstring tears. The hamstring muscles are obviously somewhere on that picture in the red bit surrounding the nerve, but most people with hamstring strains would not have what we call sciatic nerve pain. Some patients may not be able to detect the difference, and so again someone may have convinced themselves they have the S word from a straightforward hamstring strain. Bearing in mind, rest is the worst thing you can do for muscle strains. Therefore, if you're resting on the basis of the S word because someone told you to do that, they might have had a bad back problem, had pain in the same area from a disky problem. Where your hamstring strain is, well, now you've got a problem because you're going in the opposite direction. So rest is very rarely used for any of these conditions, but certainly not someone that has a hamstring strain. We want to be getting them moving, getting them strong, finding out why it happened in the first place, seeing if there's any back stiffness involved, and therefore we move away from the S word for that particular model. Another one that I'm going to bring in is hip joint. So let's talk about hip pathology, osteoarthritis and other conditions. Again, in the area that we're looking at, our hip joint's pictured on this, you could have a problem where the tightness around a hip joint problem would cause muscle tightness. And again, in the region of the sciatic nerve, you could get some problems there that again would feel similar in symptoms in terms of what the patient feels and where they press. But actually, the tests we do, we would see the hip joint is the diagnosis in terms of the problem area, may trigger an X-ray, and it's not unusual for someone who's treated for mild hip osteoarthritic problems that the sciatic pain that was the reason they came to us in the first place disappears. Therefore, the diagnosis is hip joint problems and not the S word. The more severe one, where we would sense that there's more going on than just the pain down in the buttock and the leg, might trigger a hip X-ray. The answer might be there in black and white. The hip joint is in a very bad way, and certainly the consultant that sees that X-ray may think similarly the hip joint is the issue, and of course things like hip replacements could take place, and therefore if that person then had a hip replacement successfully, that sciatic area pain would disappear because the source of the pain has been addressed. Again, totally different presentation in terms of the test we would do, but of course the symptoms might feel similar to the patient, hence the reason we wouldn't call it the S word. So any questions that you want to pop on as we're going along, please do. There was one more injury I was going to include. The acute injury where you fall. If you fall onto the area where the sciatic nerve lives, you can have sciatic nerve pain. If I hit an area hard enough, I get a bruise. If the bruise is big enough and bad enough and might not ice it enough, you could end up with the worst sciatic nerve pain in the corresponding sort of day or two after a fall. Again, how would you diagnose that with the S word? I would tend to call it a bruise in the wrong area and tell the people to ice and foam roll and let's get the strength in the absence of a need for an x-ray. So sometimes the S word might be an acute injury rather than a chronic build-up there. So I'm just going to have a look and see if there's any questions so far that we want to bring in. Yeah, I think, thank you Laura for your question, the pins and needles and numbness, without again going too far because it's a big topic. Certain conditions where pins and needles and numbness are likely to happen, which would be the more prolapsed protruding disc situation, we would definitely keep an eye out for that as a clue in the assessment, and that brings a lot of people to us. And you would know if you were getting someone better with the right diagnosis and treatment because that symptom would change or not. Muscle weakness is a big one for us here at Platinum. We do not hesitate to send someone straight to the GP or other if we're worried about the strength in a set of muscles down that sort of sciatic nerve region, because if it is a significant muscle power loss, then often that needs an urgent MRI scan, as does bladder and bowel problems or numbness in the saddle region. So any numbness that's unusual, any bladder and bowel changes, we would be looking at a possible diagnosis. It is a very important one to make, and the S word would not fit that bill. There's one more I need to ask about that Laura's just reminded me, and that's a condition that we call neural tension, which literally means tight nerve, or sciatic neural tension, tight sciatic nerve, because it's a structure. It has a start and an end. You can see it branches out to other nerves as it goes further down. Just like a tight muscle, you can have a tight sciatic nerve, and we call that neural tension. Quite common, believe it or not, with people that are in driving jobs and things like that. The lower back can be clear in terms of pathology, but the lower back might have stiffness that's caused the nerve to become tight for whatever reason. Believe it or not, the management of a sciatic nerve tightness will be very much the opposite of a suspected disc problem. And I'll use this as an example. I'm going to show you the Swiss ball, which obviously we use a lot for. That person might need to do some sciatic nerve stretches. A lot of physios would call this flossing, where you have this position when you have the toes pointing up and you also have the head down. That's got the sciatic nerve on the biggest stretch possible from the head all the way down to the foot. The spine is continuous in terms of the nerves. So a lot of physios will do this as an exercise where the toes are going up and down, and that will be stretching the sciatic nerve. There's other ways I'll show you later on that we do it with the core muscles working harder. That exercise will be the last exercise I would give a suspected disc problem that I was worried about, because bending and the forces that come with bending, which in effect this is an extreme version of, will be very much an irritation to an unstable disc injury that will need an MRI scan. So that's an example. Sciatic nerve tension, we will stretch the nerve safely to get the person better. Suspected disc problem that will probably need an MRI scan, that is the last exercise I will give the person. It would be as useful as making them touch their toes 10 times as an exercise, which ironically is the thing that would be the most awkward test in the clinic, and we use that a lot when we ask people to bend forward to suspected disc problems. There's a pattern of pain we would expect to see. So you need to see, again, similar presentations, different treatments there. So that's most of the causes of sciatic pain. There are many others. I'm not going to go into all the medical conditions, but you don't need to be surprised. You could have cancer situations, you could have tumor situations, you could have a whole lot of situations where something in these regions is causing a problem in the sciatic nerve area. Would we call that the S word? Or if I was feeling very suspicious of a medical cause, I would not be calling the S word. I would be saying to that patient, I'm going to write a letter to your doctor because I think we need some tests. So again, further discussion and thinking about it in your mind when you've heard the S word. All of these things are in play, from the more mild muscular presentations, the piriformis, the hamstrings, to the more sinister lower back conditions, to the medical conditions that need urgent review as soon as possible. And that is why we're not a fan of someone coming in and saying, I've been diagnosed with the S word. It just doesn't make sense in my view. Now, any more questions before we talk about the next bit, which is, well, how do we approach all of this? We've got some disky stuff. Yep, no real questions there. So we've talked about the different causes. Let's talk about a stiffness problem. If something's stiff, you want it to move. So therefore you give it moving things. If we talk about the Swiss ball, and without going too much into it, we use the ball because everything we do on the ball is with stability. We need our core muscles to stop the ball from going in a different place or from us falling off the ball. So if we had a lower back stiffness, and a lot of our Swiss ballers will recognise this, we might do an exercise where we're rolling side to side, very basic stuff to get the lower back moving. If we have an up and down problem, we would do things like bridges, where we're lifting the hips up and down. They're mobility exercises, just to show what we might do with someone who we suspect has stiffness from that ligament or facet joint injury. We might do them as an aeroplane, we might do them over their front, and we might do some stretches like this, lots of different positions in that way, and then we could go into some extensions, again, lots of different things to make a lower back stiffness move. If we're talking about strength, and this is where we bring in more the disky type presentations, we want stability. We can use the wall, and I'll show you a wall exercise. I'm not using the Swiss ball in a second. However, a lot of our early presentations with the disc type problems, we would get them doing very secure, small rolling planks, very safe positions. If they can, we might get them do a plank. We might then get them doing a mountain climber, where we're going to do a steady, secure position to get the core muscles working. A lot of people, when they come in, not strong enough to do that, we will get them against the wall and to get their muscles working, doing a standing mountain climber, which is a low level yet very effective core exercise where the arms are locked out, the core muscles are working, and you're trying to get the stability around the spine. Very important. People that have sciatic pain do particularly well with that exercise early on. If they're icing the area where we tell them the injury is coming from, which might be the lower back in that case, if it's a disc injury, combined with a safe exercise like that, you will often see a reduction in leg pain immediately, purely from the core muscles working, giving the spine the security that it needs, and therefore the icing and the strength work tends to get the person in a way they can start to walk and be a lot more comfortable. So it's really important you can see those exercise choices are there. If we go to this, which is more on the loosening side, foam roller or stretches, and I'll use the words in both, we'll use piriformis as an example. In the past, and there's still some people that will do a lot of piriformis stretching, you'll see this pigeon stretch that people might have done in yoga. I'll kind of diagonal there, and it's the one where you lean forward like that, and I'm getting a nice big stretch in my right backside muscle there where the piriformis lives. These days, with this being a bit more specific with what we want out of a looseness, we would tend to use the foam roller. I'm going to go onto my right backside. The right foot is crossed over left knee, and I will get straight to that tight piriformis. If there's a problem, I would compare it to the other side, and if I have piriformis syndrome, I would expect the difference to be massive between the two sides. I would also expect that it would reproduce my so-called S pain. So I'll not say that word again, you've heard it for the last time, and therefore if I was on the piriformis and I felt the S pain down that leg, well, there is your primary route to getting it better. From then you would do some strength work in the muscles around the area, which happen to be the glutes. Loads of options. If you're a Swiss ball person, which we tend to advise with this type of condition, we would do bridges, with it being good glute core strength work. If you have to do it on one leg, then of course that becomes a little bit more specific. If the lying down exercises is a bit too much, then you've got your standing exercises. And what you'll do, you'll see me do a single leg squat using lots of glutes, and that combination, 3 exercises plus foam rolling on the piriformis, would nip most piriformis syndromes in the bud very quickly, takes the problem away that was never a back problem in the first place. So that's an example of the different ways that we would do it. In terms of the other exercise choices, people often say about walking. A lot of these conditions, it won't really change either way. If it's a back condition, we love people to be walking, because you're better walking than sitting, particularly the more sinister things. You're better to be active. But walking won't strengthen in the context of core, hip strength work. You're clutching at straws to say it will make a massive difference. You still want to be walking, but you still want to do strength work to make the walking more effective as a guide to how you're doing. So it's very tricky with the sciatic world of injuries. People say to me, but I walk every day, I walk the dog. But when you drill it down, the amount of strength work in that walking is not enough, but it's better than sitting down. So always be aware, cardio, strength are 2 different things. If there's a weakness, you won't walk yourself out of that weakness, and you won't sit yourself out of that weakness either. Now, is there any questions there, just before we go on to a few other things. Just pop them down now. I'm just going to have another look there. Pregnancy, that's one that's come up. I'll have a talk about that in a second. And then we might just touch on the surgery. Yeah. What I might add to the one from Rich, thanks for that, is deep tissue massage beneficial for sciatic-related pain. It comes back to what we're saying. The diagnosis is crucial. We will loosen off the muscles in the treatment itself if we find there's a muscle that is tight. And with the sciatic group of injuries, there will normally be something that's tight, whether it be the back, the glutes, the piriformis, the hamstring, or a hip muscle if it's a hip arthritic situation. So we're loosening that off. We call it physiotherapy. You've called it deep tissue massage, whatever you want to call it. You would then be using a roller to keep that loose. So then if we did need to review it, you've been able to positively influence what we've helped as health professionals to stop it from tightening up. And that's the idea. We loosen it off, you keep it loose, particularly with something like the foam roller, and then you strengthen the weak areas, which will stop the muscle from tightening up again. So yes, we would use hands-on techniques depending on the diagnosis, but if someone had sciatic-related pain and they had perfect movement and it was all about weakness with no muscle tightness, then actually this bit of it and the really deep tissue work, the physiotherapy, is not as important. This might be the most important. It's not unusual for me to tell my patients, you can do these exercises hourly. People that know me well will know that. I'm saying it for a reason. It is a green light to say you cannot do too much of these exercises. And if it's something like a rolling plank, as an instance, for someone that's a bit early on in their core journey, it might be you get tired in the core after 10 or 15 of these. So let's do them every hour when we're at home. Let's get 100, 150 a day. We know your core muscles will tell you if they're working, and we know the next day you'll feel like you've used them. That's what we want, because if that's happened, the chance of your sciatic nerve pain has plummeted. So I hope that helps there, Rich. Diagnosis dictates whether we're down the tightness and stiffness route or weakness, where we're down the strength route. Now, I just want to touch on another one with the pregnancy. We have a huge amount of pre and postnatal patients here. We treat them over video link, obviously with the COVID way things are for people that live out of area as well. It is the strength work that can help early on when pregnant mothers-to-be are getting this type of pain. It is very easy to strengthen up, and the ball actually comes into play a lot earlier than labour ward. We've had a few Swiss ballers that have gone to 38 weeks pregnancy, gestation period, and still doing classes with modifications. Their core muscles are ticking over nicely, ready for the labour to come, and therefore the postnatal recovery is much better, which makes sense. So therefore sciatic nerve pain in prenatal for me is a massive clue that we need to do something with your core. It may not be high level, it's likely it won't be, but it might be something as much as being able with a Swiss ball to hold the ball there to do some standing mountain climbers. Not very high, because obviously the belly will get in the way eventually, but just still doing something. Can the person be in standing and do some gentle squats to keep the core muscles ticking along? Can the mother-to-be be in sitting, and there might be a point in time that even doing this with an opposite arm might be the most they can do. So you can do so much to prevent sciatic pain in the journey of the pregnancy, and those mothers-to-be do very well with core work on the Swiss ball, because you can change the goalposts as you go along with the different positions that it offers us there. So hopefully that makes sense. Obviously postnatal, if you haven't done any core work, then it's never too late to start, and that's not a bad time to start. Obviously the sooner the better, depending on whether you've had C-section and all of those other things that complicate the timings a bit. Right, let's have a look. Surgery, I'm going to talk about in a second, and I'll see if there's anything else there. Nearly there. Yeah, so surgery, again, you have to take every case on how it presents. I am fortunate as an experienced physio. I can predict in my own mind with a new patient with symptoms that don't stack up, muscle weakness, sensation problems, may or may not have had an MRI. I get a feel for whether A, they will need an MRI, depending on the response to treatment, and whether they will possibly or probably need surgery. We're pretty good at that these days, because you can pick the 1 mile away that just doesn't sound right. That person needs to have the confidence to do as much strength work going into the surgery, even though they will be in pain, because the best case scenario is the surgery can be avoided, and I would say many of our 5,000 Swiss bowlers that have come through have had that success. It wasn't that surgery had been confirmed, but it was being talked about a bit too strongly and prematurely for my liking, because they hadn't done the strength work to justify the surgery talk. And that's really important. If you know you've got to strengthen, then don't commit to the surgery with the surgeon until you both know that you've exhausted all other avenues. However, if you need the surgery, you'll always have a better outcome with stronger core muscles. That's a given that everyone that has surgery knows about. So that's important. The different types of surgery, it is different. Sometimes the consultants will take bits away, as in microdiscectomies, where they do a bit of chopping and shaving, and laminectomies, a little bit of shaving of the bones. Other times we'll be putting things in. And the word fusion is again a bit messy because people don't understand what it means. These days a fusion is, without showing you pictures, they kind of put a cage from one vertebra to the next one. So it's not a fusion in the context of everything's sucked out and a fusion goes in. It's not. It's more of a support mechanism where they would put something in to support an unstable or a very weak disc. Same strength work, same goal of the operation, and that's obviously to stop the pain, which will almost always be the leg pain or pins and needles or symptoms that take the person to the consultant or the physio in the first place. So surgery is all about stability and strength, and the earlier you strengthen pre and post operation safely, the better. We certainly like to get our Swiss ballers or our post-op back operations on the Swiss ball as early as possible after the surgery, which is the right way to go about it. So we're nearly there. About 3 or 4 more minutes, I would think I've got to talk about things. So let me just have a little look there. Yeah, prolapse disc, we've talked about that. The material from the tear irritates the nerve. Mandy, that would be correct that a consultant could say that, because that's where a lot of the nerve irritation is. Again, it comes down to the strength work you've done. Does it satisfy yourself, the consultant, and anyone else involved in your treatment that you have done the strength work to make a decision on the surgery the consultant may or may not be proposing? That's really important. And if not, you want to start that straight away, and then as you go towards the journey with the consultant, if surgery is being organised, then you're confident you're making the right decision. That's really important. But a protruding disc on an MRI scan that is a nasty one, the consultant will tell you what he feels. They're usually quite good at explaining why they feel it might not respond without surgery. And as I said, in 2020, I think that surgeons are very good at picking those that will need surgery, but you want to make sure you've done that strength work. Really important, because you need to do that after. Any other questions there? Just pop them up there. And I hope that so far you've learned a lot about the S word and why we find it awkward. When people come in and it's self-diagnosed, it's tricky. When it's been diagnosed by health professionals, it's trickier. And that's because I think you need to appreciate, from our point of view, the history at that point when someone's telling us. It's hard to take all of it as something we can run with, because in my view, the S word is not a diagnosis, therefore the treatment of what's happened is often messed up. It could be someone's doing strength work and they need more foam rolling, or it might be more of a stiffness problem and they're doing static planking and they don't match. It could be a disc patient that's being treated, a disc patient's being treated as they had a hamstring strain, and conversely, many people with hamstring pain is the result of a stiff back that's causing recurrent hamstring strains, and many footballers have found this out the hard way. And I've treated a few where after the 4th or 5th hamstring strain, we might see them for the first time and it's got lower back written all over it, and no one has looked at that lower back. The S word doesn't really factor into that. So it's just having that awkward conversation, say, well, let's move away from the S word. It's not a diagnosis. You may need to just put it to one side in the nicest possible way, and let's have a look at what's really going on and how to treat it. So if anyone wants to ask any more questions after we finish, certainly do contact us via the message of the Platinum Facebook page. Email addresses, I think, were on the links that you would have seen on Facebook. As many of you know, and some of you don't, we do loads of classes to help people with these kind of injuries. The Swiss Ball is our flagship lower back class. We've run that since 2010. Had about 5,000 people come through, and we currently run over 20 Swiss Ball classes a week via the video link to people all over the world, as well as in the studio for those that live in the northeast there. At the same time, if anyone's got questions about foam rolling, we can help with that. We can do foam roller pictures that might help you for things like the piriformis, or we do foam roller class. You just do that the once. Again, we do it by video link to people all around the world, and that is something you just do the once to learn how to get to your pain. Once you find the technique, then it's something you should do every day. I think the other thing is, don't be afraid to question, and it's anyone. It could be a health professional, it could be a friend, it could be a family. There's a lot of people that use the S word, and maybe sometimes people should say, can you just take that a bit further and explain it? And I think if you're not afraid to ask that question when someone says that diagnosis to you, I think you'll find it often can help, and then people can be a little bit more specific with where they're going with it. And that's why in this practice you're more likely to be sent home with a diagnosis of an L5-S1 strain causing some sciatic nerve tightness or a suspected disc injury that we may need an MRI scan for, but in the meantime we're going to do this, or piriformis syndrome, as opposed to being sent home with a piece of paper with an S word on it. So thank you everyone, hope that helps. I'm going to get ready for the Friday night Swiss ball class. I think a few of you were joining in, and contact if you've got any questions. If you want to organise a trial for any of our Swiss ball or other classes, timetables on the Facebook page, and of course for any physiotherapy information there. Thanks for everyone, and we'll hopefully see you at the next Facebook presentation. See you then.